Yes, I've been asked to talk about the patient's decision when faced with the option of being screened for lung cancer. And I think for a start off, this is a difficult area, and we have seen some very good studies with some pretty good methodologies show really quite minimal effect on our ability to give people information so that they can make an informed choice. And patients often come with the choice already made before they start the process. But just a few principles for a start off. Often when we explain things to patients and patients seek information, it's on a population level. It can only often be on a population level without detailed knowledge of the patient's individual features. And this applies to all of medicine. So if you, for example, are explaining that somebody might be at risk when they have surgery for their lung cancer, then you're talking about the population risk, the mortality of 1 in 200. But if you're the individual that actually has that complication, then it's very different. So the personal risk and what happens to the person is different from the population risk. All you're saying to the person is a chance. And that's even more the case with something like lung cancer screening. So what do we know? Well, we give people pictograms and various decision aids to try and get the information over to them. And in my presentation, I'll be reviewing some of those suggested information for the sources and show you really how difficult they are to understand. And, you have to be a pretty savvy person to appreciate a lot of what's been said in those documentations, especially the nuances behind some of the figures, which are really difficult to get over. So I don't think we're there with that. And there are quite a bit of guidance on shared decision making, and in the US at least, you have to have a shared decision making visit before you can even get into a screening program, which some people believe is one of the reasons why there is actually a relatively low participation rate in the US. And the shared decision making process is quite complex and quite slow. And patients often don't want a slow, complex procedure. They just want to get on and either have their scan or not. So there is a school of thought that that's exactly what should happen, which also I don't adhere to. So the other thing is the influence of all the people around them in making their decision. That can be much more influential than any of the information that we give them. So I'm going to suggest at the end of the talk a discussion and say that I think that we should focus very much on just one or two key points in the information and allow the patient then to ask questions, or the participant to ask questions, I should say, about any of those key points. If they don't ask any questions and make a positive decision, then I think that's probably all we can expect. It's not in line with the psychological teaching, which it teaches about informed decision making, and that would not guarantee that process. But I think it's a pragmatic solution and probably something that really suits the participants.